We want to talk about a trend some paramedics are seeing when treating patients showing symptoms of COVID-19. As our Eric Alvarez reports, some people who call an ambulance simply aren't getting the proper follow-up care.
Report feeling nauseous, sick to their stomach, and vomiting.
50. That's how many emergency calls MedStar takes in every day from people reporting COVID-19 symptoms. But to prevent hospitals from overcrowding, MedStar is only transporting patients in need of immediate care.
We wanted to not bring patients to the emergency department that did not need to be in the emergency department.
The patients who aren't transported are instead given these pamphlets, instructing them on how to prevent the spread to others even in their own homes. Patients also receive information about where and how to get tested and are encouraged to talk to a doctor. But a recent survey shows almost 90% of them never do.
That finding is a little bit interesting because you would think that if someone had called 911 for some type of a medical assessment, that the follow-up care would be important.
The results come from a survey of 93 people that MedStar assessed in their homes but did not transport to the hospital. The survey also shows about half of them went on to get a coronavirus test.
Half of those actually tested positive, so it was a pretty high positivity rate from the patients who called 911 for help.
Despite high rates of positivity and low rates of consulting a doctor, 100% of the survey respondents tell MedStar they're feeling much better now. But that's not a reason to take the virus lightly. It's important to note this is a survey of people who were assessed by MedStar professionals who determined they did not need emergency care. MedStar encourages anyone showing symptoms to seek medical help.
We strongly encourage people to have a good relationship with your doctor. If you don't have a doctor, get one. If you need some in-home assistance, you can use telemedicine. There are a number of things that you can do now. But always, if you think that you have a medical emergency, please do not hesitate to call 911. We are happy to come help you. We don't have to take you to the hospital.
In Fort Worth, I'm Eric Alvarez.